Well, in the 1950s, about 1 in 50 professionals required an occupational license, but today, nearly 1 in 3 workers require one. Now, a new task force is releasing their findings on how to improve licensing in Oklahoma. And we are joined now by Labor Commissioner Melissa Houston. Thank you so much for being here.
Absolutely. Thank you for having me.
Okay, this was a big undertaking, right? You wanted to take a look at our state. What are we doing here? It may sound kind of boring on the surface, but really when you get down to it, we're talking about jobs and people being able to get a job that they want without having a burdensome process. Talk about this commission.
Exactly. And you're right. It does sound kind of boring at first when you think about it. But as you said in the opening, I mean, it used to be 1 in 50. Now it's 1 in 3. What we're talking about basically is a permission slip from the government to work. So whatever profession you are in order to earn a living and support your family, the government has to give you permission to do that. And they have a series of requirements, training hours, fees that you have to pay, and all of that is what's called an occupational license. It's a license to have your occupation. And so when you now have 1 in 3 that are licensed, that pretty much is almost most occupations are going to be impacted by that. And it's important because, I mean, first of all, that's somebody's, purpose and ability to support their family. So it can be keeping people in poverty unnecessarily. And again, it's the government that is doing that. So you need to really make sure that there is a governmental interest in order to not, keep people from working. So what the task force did, the first challenge that we had was just getting our hands around the process in general. When people would ask me, how many licenses do we issue? We couldn't answer the question because there was no kind of central website or database or anything that you could go to. So that was really the first step. You can't fix the problem if you can't define the problem. So we did a number of surveys through the cabinet, through the budget process, just trying to find out who all issues licenses in the state of Oklahoma. Most people would be interested to know we have about 300 agencies, boards, and commissions. Each one of those issues multiple licenses. And so you have to go to each one of those to ask that question. So the first thing coming out of the task force is to have that database that members of the public can use, the media, and policymakers to help determine how big is the problem in Oklahoma. The second piece, it was really important to us not to just issue a report that would just sit on a shelf. And I mean, we have plenty of groups that do that, right? So for us, we wanted to have tools that legislators could use to help address the problem. So the first tool is the data. The second tool is what we call a blueprint. Basically, all this is a list of questions that you could ask or a policymaker could ask in determining whether or not there should be a license. Should this license be created? Should it be repealed? And we want to get everybody on the same page. This blueprint is actually a model for the rest of the country. This is a huge issue nationally. The Trump administration is very much interested in reducing the number of occupational licenses to help people work, help people get jobs. But interestingly, so was the Obama administration because it was keeping people in poverty. So I can tell you from a public policy standpoint, when you have the right and the left who both say this is a problem, it's usually a problem. So we want to make sure that we are giving meaningful tools to our policymakers.
So what can we do here in Oklahoma to make it better? What is your suggestion?
Well, I think this blueprint will really, because what happens today is an occupation will go to a legislator and say the sky will fall if we don't have a license. And because the legislature may not be in that profession, they don't know the questions to ask. They have to rely on the person who says this needs to be regulated, who may have a self-interest in it being regulated. And so we've got to get everybody asking the same questions in an objective way. That's what this blueprint does. The first series of questions revolve around what is the government's role? Because again, it's the government giving you permission to work. There may be times when that's appropriate. If there's a public health concern, a public safety concern, some sort of fiduciary duty, or a fundamental right. Other than that, the government probably should stay out of it.
So really, is it less regulation, less licenses, do you feel?
We feel like there certainly should be because it's the highest level. The second part of the blueprint are what are the alternatives to licensing. There's about 12 different ways that you could regulate an industry without requiring a license. Roofers are a great example. We have a big problem with roofing after natural disasters. What the legislature has decided is to require registration. So rather than a license, they have to register, show that they have insurance, show that they've paid their taxes. Registration sometimes is enough to protect the public health. And then the third area really gets into who's on the board. If you have a group of people, the most famous case is the NC Dental Board case, where you had a group of dentists who said, in North Carolina, who said no one can do teeth whitening but us. Well, the hygienist didn't agree with that, but it was the dentist in the room who profit from no one else doing teeth whitening except at that higher level. And the Supreme Court said, yeah, that's not how you use a board position. So the third area of the blueprint tries to uncover that. Like, who are on our boards? Are they all people in the market? Are they all people who have a vested interest? Because that's not the role of the government.
Right. There's a lot of layers, like you said, and it's going to
Lots.
take time. You want to make sure people have access to jobs, don't want something to be overregulated if it doesn't need to be, and you got to know who is pushing for this. Do they have a self-interest?
Exactly. And so
Yeah.
that's what these tools are able to do for members of the public, the media, for policymakers, so we can all ask very objective questions, very transparent. Let's all have this discussion. And hopefully that way, because there are some times, I mean, I want to make sure my doctor has a license. I mean, I think that's a pretty good public health concern. But when you're talking about something like braiding hair, it requires 1,600 hours to get a license to braid hair. Now, I'm not talking about manicurist, where you may have some public health concerns with infectious diseases or hair, you know, with the chemicals involved. I mean, there are areas, but when you're talking about something as simple as braiding hair, 1,600 hours, I mean, that seems a bit excessive. So trying to ask the right questions to make sure that the government isn't being overly burdensome and keeping people from earning a living, supporting their family, that's not what we want the government doing.
Labor Commissioner Melissa Houston, thank you for being here
Thank
today.
you.
We
Appreciate it.
And we'll keep tabs. You know, this thing is going to be continuing, and we're going to be watching.
And it's all available on our website, labor.ok.gov.
Thank you so much.
Thank you for having us.